MRI abdomen, or magnetic resonance imaging of the abdomen, is an advanced imaging technique that uses a strong magnetic field and radio frequency waves to produce detailed images of the internal organs within the abdominal cavity. This examination provides clear visualization of the liver, gallbladder, pancreas, spleen, kidneys, and abdominal blood vessels, allowing precise assessment of both structure and function. MRI abdomen is typically performed for evaluation of hepatic lesions, liver cirrhosis or fatty liver, assessment of pancreatitis, pancreatic masses or biliary obstruction, detection of renal masses, cysts, or vascular abnormalities, and for investigating unexplained abdominal pain. During the procedure, the patient lies inside an MRI gantry, a tunnel-shaped scanner. To enhance image quality, a gadolinium-based contrast agent may be administered, which helps to differentiate between various organs and tissues more clearly. The entire procedure is non-invasive, painless, and usually takes about 30 to 60 minutes to complete. Before the scan, all metallic objects must be removed as they can interfere with the magnetic field. For pregnant patients or those with renal impairment, proper precautions should be taken before administering contrast material. The final report provides detailed anatomical and pathological analysis of each abdominal organ, playing a vital role in accurate diagnosis and treatment planning.